Question 1. A patient with generalized anxiety disorder is pacing and wringing their hands. Which action should the nurse take first? A. Offer the patient a PRN anxiolytic medication. B. Guide the patient to perform deep breathing exercises. C. Leave the patient alone to calm down. D. Notify the healthcare provider immediately. Answer. B. Guide the patient to perform deep breathing exercises. Question 2. Which patient should the nurse assess first after shift report? A. A patient with obsessive-compulsive disorder who is late taking medications. B. A patient with post-traumatic stress disorder reporting nightmares. C. A patient with panic disorder experiencing chest tightness and dizziness. D. A patient with social anxiety requesting to stay in their room. Answer. C. A patient with panic disorder experiencing chest tightness and dizziness. Question 3. A nurse delegates to an unlicensed assistive personnel, UAP, to monitor a patient newly started on buspirone. What should concern the nurse? A. The UAP records fluid intake and output. B. The UAP encourages the patient to ambulate. C. The UAP reports the patient is dizzy when standing. D. The UAP offers a snack with the medication. Answer. C. The UAP reports the patient is dizzy when standing. Question 4. Which task is most appropriate for the nurse to delegate to a licensed practical nurse, LPN? A. Assessing a patient experiencing a panic attack. B. Teaching a patient about lorazepam use. C. Administering an oral dose of sertraline. D. Evaluating the patient's coping mechanisms. Answer. C. Administering an oral dose of sertraline. Question 5. A nurse is caring for 4 patients. Which should be assessed first? A. A patient with generalized anxiety disorder who refuses group therapy. B. A patient with panic disorder who is hyperventilating and diaphoretic. C. A patient with OCD who has not completed a ritual. D. A patient with PTSD who requests a PRN sedative. Answer. B. A patient with panic disorder who is hyperventilating and diaphoretic. Question 6. A patient experiencing a panic attack says, "I feel like I'm dying." What is the nurse's priority action? A. Call the rapid response team. B. Perform a physical assessment. C. Stay with the patient and speak calmly. D. Offer reassurance that nothing is wrong. Answer. C. Stay with the patient and speak calmly. Question 7. A patient with anxiety disorder is prescribed clonazepam. Which instruction is most important to include in discharge teaching? A. Take the medication at bedtime with food. B. Do not stop the medication abruptly. C. Report feelings of drowsiness to your provider. D. Limit caffeine intake while on the drug. Answer. B. Do not stop the medication abruptly. Question 8. Which finding indicates the most serious risk to patient safety in a hospitalized patient with anxiety disorder? A. Patient paces hallways for hours. B. Patient reports difficulty sleeping. C. Patient isolates from others. D. Patient expresses feelings of hopelessness. Answer. D. Patient expresses feelings of hopelessness. Question 9. A patient with severe anxiety is scheduled for discharge. Which task is appropriate to delegate to a UAP? A. Reinforcing relaxation techniques. B. Helping the patient pack personal items. C. Teaching the patient about community resources. D. Explaining medication side effects. Answer. B. Helping the patient pack personal items. Question 10. A patient newly diagnosed with social anxiety disorder refuses to attend a group session. What is the best nursing action? A. Document noncompliance in the record. B. Force the patient to attend for treatment success. C. Respect the decision and explore reasons privately. D. Inform the provider the patient is uncooperative. Answer: C. Respect the decision and explore reasons privately. Question 11. A nurse observes a patient with anxiety breathing rapidly and holding their chest. What is the initial nursing intervention? A. Provide a paper bag for rebreathing. B. Instruct the patient to slow their breathing. C. Administer prescribed alprazolam. D. Call for help and obtain a crash cart. Answer: B. Instruct the patient to slow their breathing. Question 12. A nurse prepares to administer lorazepam to a patient with panic disorder. What action should be taken first? A. Ask the patient to sign consent. B. Educate the patient about possible dependency. C. Check the patient's respiratory rate. D. Ask the patient if they want the medication. Answer: C. Check the patient's respiratory rate. Question 13. Which action by the nurse best promotes safety for a patient with acute anxiety and poor impulse control? A. Place the patient in seclusion. B. Keep the patient under constant observation. C. Give the patient a fidget toy. D. Assign the patient to a private room. Answer: B. Keep the patient under constant observation. Question 14. A patient with obsessive-compulsive disorder, OCD, is upset because their routine was interrupted. What is the nurse's best response? A. You need to learn to adapt. B. Why does this matter to you? C. Let's talk about how that made you feel. D. That's not something you should be upset about. Answer: C. Let's talk about how that made you feel. Question 15. The nurse plans care for a patient with generalized anxiety disorder. Which intervention has the highest priority? A. Encouraging journaling. B. Teaching stress reduction strategies. C. Assessing suicidal ideation. D. Encouraging social interaction. Answer: C. Assessing suicidal ideation. Question 16. A patient receiving cognitive behavioral therapy, CBT, for anxiety reports worsening symptoms. What should the nurse do first? A. Notify the therapist. B. Encourage the patient to stop therapy. C. Document the report as expected. D. Increase the patient's medication dose. Answer: A. Notify the therapist. Question 17. Which task should the nurse avoid delegating to a UAP caring for a patient with severe anxiety? A. Assisting with meals. B. Providing hygiene care. C. Monitoring for safety risk behaviors. D. Obtaining vital signs. Answer: C. Monitoring for safety risk behaviors. Question 18. A nurse is caring for a patient with panic disorder. Which environmental modification is most therapeutic? A. Bright lighting and music. B. A quiet room with minimal stimulation. C. A shared room with engaging patients. D. Frequent loud announcements for orientation. Answer: B. A quiet room with minimal stimulation. Question 19. A patient is prescribed escitalopram for anxiety. Which finding requires priority intervention? A. Dry mouth. B. Nausea. C. Suicidal thoughts. D. Weight gain. Answer: C. Suicidal thoughts. Question 20. Which instruction is most important when teaching a patient about benzodiazepine use for anxiety? A. Avoid driving until you know how the drug affects you. B. Take the drug at the same time every day. C. Do not take it with antacids. D. You may stop the drug if symptoms improve. Answer: A. Avoid driving until you know how the drug affects you. Question 21. A nurse observes a patient with anxiety repeatedly checking door locks. What is the best initial action? A. Instruct the patient to stop immediately. B. Distract the patient with a new activity. C. Allow time for the ritual, then explore its purpose. D. Ignore the behavior since it is not harmful. Answer: C. Allow time for the ritual, then explore its purpose. Question 22. Which patient statement best reflects understanding of generalized anxiety disorder management? A. I will avoid all stressful situations to stay calm. B. Taking deep breaths might help me manage my anxiety. C. I don't need medication if I feel better today. D. If I feel anxious, I will drink coffee to stay alert. Answer: B. Taking deep breaths might help me manage my anxiety. Question 23. A patient with panic disorder reports tingling in the fingers and lightheadedness. What should the nurse assess next? A. Medication history. B. Presence of suicidal thoughts. C. Breathing pattern. D. Blood glucose level. Answer: C. Breathing pattern. Question 24. Which intervention should the nurse avoid when caring for a patient in acute anxiety? A. Encouraging expression of feelings. B. Giving lengthy explanations. C. Using short, simple instructions. D. Staying physically present. Answer: B. Giving lengthy explanations. Question 25. Which patient should the nurse assign to the RN rather than the LPN? A. A stable patient with anxiety requiring daily sertraline. B. A patient needing teaching about diazepam tapering. C. A patient requesting help with hygiene due to anxiety. D. A patient waiting for results of a routine blood test. Answer: B. A patient needing teaching about diazepam tapering. Question 26. A nurse is prioritizing care. Which patient should be seen first? A. A patient with social anxiety disorder refusing meals. B. A patient with panic disorder who reports palpitations. C. A patient with OCD performing repetitive hand washing. D. A patient with GAD requesting extra pillows. Answer: B. A patient with panic disorder who reports palpitations. Question 27. Which statement by a patient indicates effective coping with anxiety? A. I avoid everything that makes me anxious. B. I take sleeping pills whenever I feel anxious. C. I use meditation to help manage my stress. D. I yell at others when I feel overwhelmed. Answer: C. I use meditation to help manage my stress. Question 28. The nurse is caring for a patient with PTSD. Which behavior requires immediate intervention? A. Frequent nightmares. B. Social withdrawal. C. Carrying a pocket knife for safety. D. Avoiding eye contact. Answer: C. Carrying a pocket knife for safety. Question 29. A patient on long-term benzodiazepines suddenly stops taking them. What symptom is most concerning? A. Rebound anxiety. B. Insomnia. C. Muscle cramps. D. Seizures. Answer: D. Seizures. Question 30. The nurse teaches a patient about propranolol for situational anxiety. Which statement indicates a need for further teaching? A. I should check my pulse before taking it. B. This drug will help me feel less shaky. C. I'll take it right before the event. D. This drug will cure my anxiety permanently. Answer: D. This drug will cure my anxiety permanently. Question 31. Which nursing intervention is most appropriate during a severe panic attack? A. Offer choices to give the patient control. B. Explain the source of the anxiety. C. Stay with the patient and speak in calm, clear phrases. D. Encourage journaling. Answer: C. Stay with the patient and speak in calm, clear phrases. Question 32. A nurse is reviewing care for 4 patients with anxiety. Which patient is most at risk for medication non-adherence? A. A patient with stable housing and routine. B. A patient with a strong family support system. C. A patient recently discharged from inpatient care with poor insight. D. A patient involved in group therapy. Answer: C. A patient recently discharged from inpatient care with poor insight. Question 33. A nurse preceptor is evaluating a student nurse caring for an anxious patient. Which action requires correction? A. The student explains all procedures thoroughly in advance. B. The student stays with the patient and maintains a calm presence. C. The student encourages the patient to use relaxation techniques. D. The student validates the patient's feelings. Answer. A. The student explains all procedures thoroughly in advance. Question 34. A nurse is developing a care plan for a patient with GAD. Which is an appropriate short-term goal? A. Patient will express understanding of the disorder by discharge. B. Patient will eliminate all anxiety-related thoughts within 48 hours. C. Patient will verbalize 2 coping strategies within 2 days. D. Patient will stop worrying immediately. Answer. C. Patient will verbalize 2 coping strategies within 2 days. Question 35. A patient receiving treatment for anxiety reports chest pain. What is the nurse's priority action? A. Assume it's anxiety-related and continue monitoring. B. Assess vital signs and perform a focused cardiac assessment. C. Administer a PRN anxiolytic. D. Ask the patient to relax and try breathing exercises. Answer. B. Assess vital signs and perform a focused cardiac assessment. Question 36. A nurse delegates tasks to a UAP caring for a patient with anxiety. Which instruction is most appropriate? A. Teach the patient about deep breathing. B. Report any signs of agitation or pacing. C. Discuss medication effects with the patient. D. Evaluate the patient's response to treatment. Answer. B. Report any signs of agitation or pacing. Question 37. Which statement by a patient taking paroxetine for anxiety requires immediate follow-up? A. I've had a dry mouth since starting this medication. B. I sometimes feel nauseated in the morning. C. I've had thoughts of harming myself lately. D. It takes a few weeks to feel better. Answer. C. I've had thoughts of harming myself lately. Question 38. The nurse is caring for a patient in the emergency department who is hyperventilating due to panic. What is the priority action? A. Provide reassurance and guide slow breathing. B. Encourage the patient to explain what triggered it. C. Offer water and comfort measures. D. Place the patient in a busy hallway for monitoring. Answer. A. Provide reassurance and guide slow breathing. Question 39. Which of the following is a long-term goal for a patient with anxiety disorder? A. Patient will remain free of anxiety. B. Patient will verbalize a plan to manage future anxiety. C. Patient will eliminate all panic episodes. D. Patient will refuse all medications by discharge. Answer. B. Patient will verbalize a plan to manage future anxiety. Question 40. A nurse is evaluating a newly diagnosed anxiety patient's understanding of buspirone. Which statement shows correct understanding? A. This medicine works immediately to calm me. B. I can drink alcohol with this medication. C. It may take a few weeks to feel the full effect. D. I'll take it only when I feel anxious. Answer. C. It may take a few weeks to feel the full effect. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.